Therefore, effective immediately, I am canceling the last administration's completely one-sided deal with Cuba. Our new policy begins with strictly enforcing U.S. law.
For decades, Cuba has quietly come to the rescue of Jamaica's healthcare system. In a country where hospitals are overwhelmed and the shortage of doctors is a constant challenge, Cuban doctors have been filling the gap and providing critical medical care to Jamaicans. But the truth is, without the Cuban doctors, the Jamaican healthcare system would struggle to survive. Jamaica has a long history of challenges in the medical sector. The public healthcare system is underfunded, overcrowded, and constantly grappling with shortages of medical professionals. The country's medical schools are not producing enough graduates to meet the demand, and many doctors choose to leave the island for better opportunities abroad. This has left public hospitals in a perpetual state of crisis. For years, Cuban doctors have been a lifeline for Jamaica's medical system. Over 100 Cuban doctors have been working in Jamaica's hospitals, providing much-needed specialized care in fields like surgery, pediatrics, and cardiology, and rural areas, where their services are most needed, and the Jamaican public has come to rely on their expertise, particularly in remote communities where access to healthcare is limited. The US government is stepping in with a threat that could shatter the foundation of Jamaica's healthcare system. If Jamaica continues to accept Cuban doctors, the US has made it clear that it will impose severe economic sanctions and other diplomatic consequences. The US is accusing Cuba of using its doctors to further its political agenda, and the US demands that Jamaica sever ties with Cuban medical professionals or face the consequences. The US argument is rooted in its decades-long hostility towards Cuba, stemming from the Cuban Revolution and the rise of Fidel Castro's communist regime.
Gone throughout the world since the end of World War II, this one in Cuba holds no special honors or distinctions. The revolutions have gone until this one. The Cuban Revolution is very special. It's very special for several reasons, and all of them are pretty much a mystery to this fellow, John Q. American here, who is particularly wrapped up in that Cuban Revolution. He doesn't really understand what happened in Cuba back in January of 1959. Despite the fact that no other person on this planet has a greater number or a variety of ways to read about, hear about, see about, and know about things, the tons of newsprint that he's read through and the untold hours of airtime that he's listened through about turmoil and unrest and revolutions everywhere around him for years.
Will not lift sanctions on the Cuban regime until all political prisoners are freed. Freedoms of assembly and expression.
As part of its policy to isolate Cuba economically and politically, the US has made it difficult for many countries to do business with Cuba, including in the healthcare sector. The US sees the deployment of Cuban doctors as a way for the Cuban government to exert influence over other nations, and they're determined to stop it, even if that means putting Jamaican lives at risk. So what does this mean for Jamaica? If the Jamaican government caves to US pressure and removes Cuban doctors from its hospitals, the country faces a devastating loss of medical professionals at a time when it can least afford it. For many Jamaicans, this will mean longer wait times for medical procedures, fewer specialists available, and potentially higher death rates from treatable conditions. The truth is, Jamaica is caught in the middle of a geopolitical battle between two superpowers, the US and Cuba. While Jamaica is a close ally of the US and depends heavily on US trade and support, it also has historical ties with Cuba, especially in the area of healthcare. It's a delicate balance. Jamaica's government must weigh the economic and diplomatic benefits of maintaining a good relationship with the US against the real and pressing need for Cuban doctors. The US has long been a source of funding for Jamaican programs, including healthcare, but that funding comes with strings attached. The latest threat is just another example of the US using its economic power to influence Jamaica's foreign policy and healthcare decisions. But here's the question. What is the value of a relationship with a country that is willing to let Jamaicans suffer in order to make a political point? If the US pushes Jamaica to end its cooperation with Cuba, how will the Jamaican government respond to the pressure, knowing that thousands of lives could be at risk? Jamaica's healthcare system on the brink. What will happen if Cuba's doctors are sent home? If Cuban doctors are sent home, the consequences for Jamaica's healthcare system could be dire. Public hospitals, which are already struggling with overcrowding and understaffing, would face an even greater crisis. Patients would be left with fewer doctors, fewer specialists, and longer wait times for life-saving treatments. The country's medical infrastructure is fragile, and many Jamaicans rely on Cuban doctors to receive critical care. These doctors are not just filling the gaps, they're saving lives every day. Without them, the Jamaican healthcare system could collapse under the pressure. In addition to the medical crisis, there are economic implications. Jamaican hospitals would have to spend millions of dollars to recruit foreign doctors to replace the Cuban ones. This would put even more strain on an already overburdened healthcare budget, diverting resources away from other vital services like education and social programs. The human cost of this political battle cannot be ignored. Thousands of Jamaicans, particularly those in rural and underserved areas, rely on Cuban doctors for their healthcare needs. Many of these patients have no other option for specialized care, and without Cuban doctors, their chances of survival are significantly diminished. Jamaicans know the value of these Cuban medical professionals. They've witnessed firsthand the impact that these doctors have had on their health and well-being. Losing them would not only be a blow to the healthcare system, but also a betrayal of the trust that Jamaicans have placed in their government. The future of Jamaica's healthcare. A choice between political pressure and public health. The Jamaican government now faces an incredibly difficult decision. Does it bow to US pressure and risk the health and well-being of its citizens? Or does it stand firm in defense of its right to choose its healthcare partners? The answer is not simple. Jamaica's relationship with the US is crucial for economic stability, but so too is the need to protect the health of the Jamaican people. But now, the government's decision will shape the future of the country's healthcare system. As Jamaicans, we must ask ourselves, are we willing to risk our health for political gain?